Just coming up to 28 minutes past 4 mainland Spain, and we're covering something today that's essential if you're a UK national living or intending to live here in Spain. Why private health insurance is more important than ever. Even where this is Kellie from Jennifer Cunningham Insurances. She's been helping expats navigate healthcare in Spain, especially with the trusted provider ASA. Hi, Kellie. Good to have you back with us.
Thanks, Cal. It's always a pleasure to be on BayRadio. Such an important topic for people to understand, especially in today's climate.
Yeah, so let's start at the beginning. For those just moving to Spain or thinking about it, what's the number one thing they need to know about healthcare access as a UK or an EU national? Because they're not the same, are they?
No, that's right. The number one thing is don't assume that you'll automatically have access to the Spanish public health system. Since Brexit, UK nationals don't enjoy the same rights as we used to under the EU membership. And that means that if you're not working, self-employed, receiving a UK state pension with an S1 form or holding permanent residency, you're not entitled to public health care. And that's why private health insurance isn't just an option anymore, it's actually a requirement. It is a little simpler if you hold an Irish or EU passport because they are not restricted by the 90-day rule imposed by Brexit.
And does that tie directly into the visa process?
Absolutely. If you're applying for a non-lucrative visa, the digital nomad visa, or you're registering for the TIE or full residency, the Spanish authorities require proof that you have a valid private health cover, and it needs to be a policy with comprehensive hospital and outpatient coverage and all the right documentation. And ASA provides exactly that, and it's one of the reasons why we recommend them.
Jennifer Cunningham have worked with ASA for years. Why are they so trusted in the expat community?
Well, ASA have been operating for over 80 years. They specifically cater to expats, especially English speakers, and their policies offer things like access to top private hospitals and clinics across Spain, short waiting times for appointments and diagnostics, also a wide network of English-speaking doctors and specialists, and most importantly, there's no co-payments or hidden costs. Plus, the policy is guaranteed for life. They will never cancel your policy because of age, illness, or how much you use it. That's a huge deal for people who want security at that age, as they age.
Now, I'm sure there are different levels of cover from ASA. Can you break those down a bit for us?
Yeah, ASA offer three main levels of private health insurance, so you can choose the one that best suits your needs. For example, there's standard cover, and that includes coverage for all specialists and doctors on an outpatient basis, unlimited operations, including medication, 30 sessions of massage and physiotherapy per year, and basic dental treatments such as checkups, teeth cleaning, extractions, and x-rays. Then we've got plus cover, and that includes everything in the standard plan and adds an annual full medical checkup. And then the master cover, this is the most comprehensive option, and it includes all the benefits from the standard and plus plans and adds full coverage for medication, pharmacy costs during hospitalisation and checkups, plus a preventive colon cancer screening, and it's the gold standard for anyone who wants total peace of mind.
Excellent. What about cost? How does ASA compare to other providers?
Okay, the pricing is really fair and transparent, and your premium is calculated based on your age when you first take out the policy, and that age is locked in, and your premiums don't increase just because you're getting older. They're great offers for people under 50 and also lifetime discounts for everyone else, so it's a smart long-term investment.
The earlier you do it, then, the better it is. Now, we do see some delays, don't we, in the public health systems. How can ASA help us beat those queues?
You're absolutely right. Spain's public health system is excellent in terms of quality, but right now it's overstretched, and waiting lists for even basic diagnostics like scans or blood tests can run into months. So with ASA, you can skip those queues and get faster access to care. And that includes emergency services, ambulance transport to their partner hospitals, and the ability to directly choose the right specialist for your needs.
And what about pre-existing conditions? Is that a pitfall?
Well, that's important to clarify because, like most insurers, ASSA does not cover pre-existing conditions, but we'll go through all of that during the application process so people know exactly what is and what isn't covered and there's no surprises.
That's good to know, isn't it? But, there are a number of things you need to get done and need to get sorted moving to Spain, or even if you've been here for a while and think, yeah, it's about time I got some health cover. Navigating health insurance, any type of insurance really, is quite overwhelming. And I know that there's good support processes from Jennifer Cunningham for that.
Exactly. It's a personal service. It's not a call centre. We're here in Spain and we understand the system and we're committed to making sure our clients are protected, informed and at ease when they're going through the application process.
So it's not just a policy, real support, right, from real people.
That's right. And, we've got someone that takes care of ASA and they have good contact with them, because of the language barrier as well sometimes. So it is a good. It's really about people's well-being, and it's important to choose the right policy. So support can make all the difference. And with ASTA, you get both, and of course with Jennifer Cunningham as well.
You've already been making it clearer for us this afternoon, Kellie. Before we wrap up, then, what's the one thing you'd say to the BayRadio listeners to remember about private health insurance?
I'd say don't choose your health insurance based on price alone, because it isn't just about ticking a box for residency. This is about your well-being. The right policy and the right support can make all the difference. So
Okay.
that's, it's very important.
All right. And then if somebody wants to get in touch for more information or personalised quotes, because we're not all the same, are we?
No, exactly, we're not. So just drop us an email at info@jennifercunningham.net or visit www.jennifercunningham.net. We're happy to walk you through it. No pressure, just practical advice. And then, of course, we've got the Facebook pages for all the different offices and our Google pages as well. And you can look at our reviews and they speak for themselves.
And it's not just health insurance, because, of course, we talked about holidays last time, didn't we, which is your specialist
That's
area.
right.
I think you've done very well on health insurance today. So
Thank you. Yeah, because that's not my specialist area, but we have got people that do specialise in it and they're very good. Yeah,
all right, Kellie. Lovely to catch up with you. We'll talk
and
again shortly.
Thank
All right.
you.
Cheers.
Perfect. Thank you very much.
Bye.
Bye.